I would like for you to remember a time when you were younger and just playing in the park, running around with no concerns at all. The only thing we worried about was who was going to get to the merry-go-round faster, who's going to get to the slide and go the fastest. Those were the days of running free and letting all of our energy out. Now, I would like for you to think back again and try to remember if any of your childhood friends ever stopped and pulled out a funny little chamber looking thing, shook it around for several times, put it against their mouth, and took some really deep breaths. I, for one, never experienced seeing that or knew of anyone who did that. Now, as an adult, a mother, and a health profession, I can now see these little chamber things and put a name to them. They're called inhalers, and these are used for asthma. These inhalers are very common now and are used for asthmatic prevention and signs and symptoms. As a licensed nurse and working in a nursing setting with young children, I have seen and dealt with many asthmatic exacerbations and have had to give rescue inhalers to reduce the signs and symptoms. I know all of you will agree with me when I say that our airway and breathing is the most vital part of staying alive. We would not want ourselves or our children to experience any kind of respiratory distress. Some of us or our children now actually do have asthma diagnosis and receive it, if not daily as needed, for treatments to help your lungs stay strong and proper breathing airways. Today I will be discussing and informing you what asthma is, how it occurs, what signs and symptoms to look for, and finally, how you could prevent and reduce the exacerbations and flare-ups of asthma. Asthma is a condition that affects the airways in the lungs, making it difficult for us to breathe. The tubes in our lungs that carry air in and out of our lungs become inflamed and narrowed, making it difficult for us to inhale and exhale oxygen. As explained in the World Health Organization website at newsroom.fact, asthma is a chronic disease affecting people of all ages. It is caused by inflammation and muscle tightening around the airways, which makes it harder for us to breathe. It is a major non-communicable disease and is the most common chronic disease among children. Asthma affected an estimated 262 million people in 2019 and caused 455 deaths. The same website has also mentioned that many causes and those who are at higher risk of developing asthma. A person is more likely to get asthma if they have a close family member or members like a parent or a sibling who already have it. People with allergy issues, from skin allergy issues to environmental allergens, those who are more exposed to indoor or outdoor pollutions, house dust, mites, and molds have higher risks. Also, people who have been or are being exposed to chemicals and fumes, for instance, at their workplace or in buildings they enter frequently, are also at higher risk for developing asthma. People who are obese and overweight are also at a higher risk. Babies born that are with underdeveloped lungs, underweight, prematurely born, and exposed to smoke, or those who use tobacco are also at risk as well. Now, those who have already been diagnosed with asthma that have causes that can trigger it, and the flare-ups. Overexertion, increased physical activities, having acute allergies with sinus issues, being exposed to smoke, chemical fumes, and dust are several of the reasons why people get asthma flare-ups and reactions. With the understanding of what asthma is and how it occurs, I will now inform you and explain the signs and symptoms to look for and be aware of. There are several signs and symptoms to be aware of when it comes to asthma exacerbation and flare-ups. These signs and symptoms are important to know and to be cautious of to prevent a severe asthma attack. According to Mayo Clinic, an outline website at www.mayoclinic.org, asthma symptoms vary from person to person. Some are small and known more as a nuisance, whereas others for some people are more severe. Some symptoms may be less frequent than others, and more may last longer for others as well. Some signs and symptoms to keep an eye out for are shortness of breath, chest tightness, wheezing when exhaling. This is mostly in children. Trouble sleeping due to the shortness of breath, increased coughing and or wheezing. These symptoms mentioned may have increased issues with respiratory viruses like the flu or the cold. Even having simple seasonal allergies may cause asthma flare-ups. In the same website mentioned above, there are also signs that may be experienced showing their asthma has worsened. Some of the signs and symptoms are increased difficulty breathing with nose widening, louder wheezing upon inhalation and exhaling breaths, chest diaphragm rising upon inhalation while noticing the ribs showing as well, abdominal breathing with noticing higher rising than usual, more frequent use of your inhaler or nebulizer without symptoms subsiding. With these noted signs and symptoms and whether they are milder or more severe, I will lastly discuss the methods to prevent or reduce the symptoms when having an asthma attack. After realizing that you are experiencing an asthma attack or you have been newly diagnosed with asthma, there are preventable and manageable treatments that you could use to follow. With taking your medications and treatments, there are also lifestyle changes that can be followed to help reduce the risk of asthma issues. I read an article written by WebMD, editorial contributors, and medically reviewed by Puman Schwab of the WebMD site that states long-term medications are prescribed to prevent symptoms and attacks. These medications are to be taken as ordered, and if you are not having any symptoms, there are many different types of medications that are ordered by different doctors, but the way they are transcribed is mostly the same. Inhalers, different types of inhaler medications are ordered for different types and lung issues, whether for bronchodilators or for anti-inflammatory issues. There are many different types of inhaler medications that your doctor will prescribe. Nebulizers are machines that changes medication from liquid to a mist that you directly inhale via mask or tube for a certain amount of time. Again, there are different medications that are ordered by your doctor for different types of lung care. Asthma medications, either given by mouth, such as a pill, or liquid from even to an administered injection. Other than medication and treatments to take as ordered by your doctor, there are changes that you can do to help lessen the risk of asthma exacerbations. The same WebMD website reading states recommendations you could follow to help with triggers. Plan your exercise carefully. Do not overexert yourself with your running, weightlifting, or any other workout. Stop and take breaks between your exercising to prevent shortness of breath or wheezing. Be aware of your environmental surroundings. If the weather is cold or wet, try to stay indoors as much as possible. Avoid going into buildings or places that have mold, fumes, smoke, or dust that you could trigger. Your diet and meal intake can play a role. Some foods and drinks carry certain compounds called sulfites that make asthma worse for other people. Allergies. Proof your home. Wash your pillows weekly in hot water to kill mites. Regular vacuuming and surface cleaning can help reduce trigger risks. With the overall discussion of asthma, the definition, causes, and prevention of triggers, I hope you have become more aware of the diagnosis and feel comfortable in knowing what to do if you or a loved one becomes diagnosed with it or can treat the signs and symptoms when you see someone that has it. Now as adults, you can go to a park, do an outdoor activity, and when you see someone pull out that funny looking thing, shake it a few times and put it against their mouth and take deep breath. You can say, that's an inhaler, and it's for someone that has asthma. And you can now help them when they do have their flare-ups. Thank you.